Adult human obesity has been a problem in the United States for so long, and it has more than doubled since 1990, and adolescent obesity has more than quadrupled. If obesity is such a big problem in humans, then is it not a problem for animals? Obesity is a big communicable disease problem and estimates for 3.7 million deaths in the United States in 2021. Why would it not be a problem within other animal species since we are all animals? About 65% of dogs are obese or overweight in the United States. I personally have been working at a vet clinic for the past 4 years, and I have seen every day how overweight and obesity can lead to such complicated diseases and horrible things for an animal. Having an obese companion animal can increase the risk of orthopedic problems, metabolic diseases, cardiovascular, and respiratory problems and diseases. And these are all major issues within an animal's health system and body. If things go wrong, it can be deadly. In 1997, the World Health Organization declared obesity an epidemic for humans. Shortly after, the British Small Animal Veterinary Association and the World Small Animal Veterinary Association declared it a threat to pets as well. Having an obese companion animal can increase the risk for all these diseases. Starting off with orthopedic problems, the number one problem I will talk about is osteoarthritis, or just arthritis in animals. Obesity affects the weight-bearing joints more than anything else, which would be the hips, the shoulders, the stifles, carpals, tarsals, and it can affect the spine as well. The stifles are the knees in animals, and the carpals are the wrists, while the tarsals are the ankles, equivalent. Fat tissue produces cytokines, which alters cartilage in the body on the joints, but it can also affect the bone membrane and infrapatellar joints on a fat pad. They can also degrade the cartilage, which has been detected in serum of obese dogs before even showing signs of symptoms. Studies shown that weight loss improves osteoarthritis symptoms, so maintaining a healthy weight is crucial to prevent arthritis and improve symptoms that may occur. And osteoarthritis is the main symptom with obesity. They can also get more fractures and tears than other animals. In one study of 850 dogs for over 4 years, dogs that weighed more tend to have more fractures and CCL tears, and dogs that weighed less. CCL is equivalent to a human ACL. Moving around in general, especially once an animal gets older, becomes hard, and especially once that animal is obese, it becomes harder. Now, arthritis is natural for when an animal gets older, but it's worse if the animal is obese. So if you're maintaining a healthy weight, then you should get arthritis later in life, and it shouldn't be as bad than if you were obese. Some of these issues and problems you can see well when looking at your skin, but also you can also not see it when looking at internal organs. Diabetes is a main problem in obese animals for metabolic diseases, and it's a major determinant of insulin resistance and hyperinsulinemia. Cats suffer from dogs more than a type 2 diabetic, while dogs suffer more from a type 1. Cats have more risk factors for diabetes. And insulin is secreted by the pancreas to control the level of glucose, which is sugar in the body. Hyperlipidemia is also a metabolic disease that can happen, which is elevated lipid, which are fat, cells in the bloodstream, and it's typically shown in your triglycerides and your cholesterol. If left untreated, this can cause problems with your vital internal organs, such as the skin diseases that you can see outside. Diffuse scale is a typical skin disease in cats that can be caused by obesity due to them not being able to groom properly. Animals can also get pressure sores due to the distribution of weight, but other diseases such as dermatitis, which is just inflammation of the skin, can happen due to obesity as well. Another internal area of concern for obese companion animals are your heart and lungs. Starting with your lungs, a tracheal collapse is more common in small dogs because the excess fat can physically press on the trachea and can cause collapse, which stops the airway and stops them breathing. Excess weight can also exacerbate heat stroke because the animals already have a high body temp, so when they have more fat and they have a higher body temp, heat stroke can happen faster. Other respiratory diseases that can be exacerbated by obesity include laryngeal paralysis and brachycephalic airway obstruction syndrome due to the excess weight putting pressure on the airway. For your heart, increased body weight can result in effects on cardiac rhythm and increased left ventricular volume, blood pressure, and plasma volume. Obesity increases the workload of the heart due to the larger body and the more blood it has to pump through the body. This causes the heart tissue to thicken, the left atrium to enlarge, and high blood pressure, which puts more strain on the muscle and causes structural changes to worsen. With the high blood pressure, it causes the heart to work harder along with the excess weight, so it increases the risk for heart failure as well. Obese cats have a higher risk of developing heart disease due to increased metabolic rate. But with the right monitoring, by seeing how much food that they're eating and knowing the signs of obesity and how to prevent it, your animal can live a long, happy life maintaining their balanced weight. You can prevent obesity by eating a quality food, and you consult your veterinarian about a quality food and the quantity of food to feed your animal. Fat is best, but always look for a good food with good protein in it. You can look at the back in the feeding instructions to determine how much to feed your animal. Know that may be way too much. Considering my dog bag food says to feed 4 cups a day for my animal, and I feed 2 cups and she maintains a great weight. But a veterinarian can help determine how much food to feed your animal. And you can watch and see if they seem ravenous and hungry after they eat, or if they leave some of their food. That can help you determine how much to feed. And you can keep track if they start to gain or lose weight. You will always need to make adjustments. There's not one correct formula for every animal. It also just depends on their metabolic rate and how active they are in their life. You also should learn the signs for obesity. Body condition score is the number one way to do it. The score goes from 1 to 9. The ideal body score is 5, 9 being obese, and 1 being completely emaciated. You want to not be able to see the ribs looking at the animal, but if you put gentle pressure on it, then you want to be able to feel them. They always taught us a trick where you use your knuckles. You want to feel it like that, but not be able to see the ribs. You also want that tuck behind their rib cage in front of their hips to have that hourglass effect. You can also keep track of your animal's weight by noticing if their collar or harness ever needs to be adjusted, and whether it's to make it looser or to make it tighter to see if they're gaining or losing weight. And you can always go to your vet clinic and weigh your pet to keep up with their weight. All these health risks that come with obesity in animals will shorten their lifespan, so keeping an animal at a healthy weight with proper nutrition and exercise will increase their lifespan and quality of life. Obesity is the biggest nutritional problem within companion animals currently, but hopefully with the education of owners knowing the risks, obesity will start to decline. It can be prevented by picking quality food and speaking with your veterinarian to make sure it's getting the correct amount of food and on a feeding plan. And there are other signs to learn to help you keep track of your pet's weight as well.